Let's move on to hydration and chemotherapy services. Here, we need to know certain things. For a physician billing, say a physician or any other healthcare provider is administering this chemotherapeutic substances or therapeutic substances, here the reason for encounter is primary. Whereas for facilities, we have a hierarchy. And the hierarchy here is, first we need to report the chemotherapeutic infusion and then the chemotherapy injection. So you all know what an infusion is. So the provider will just figure out with the aid of a phlebotomist, they just access a vessel, preferably the veins, and through these veins they will start instilling the or administering the medicines. So commonly we do it for dehydration. So as a method of hydration, when a patient is having excessive vomiting or diarrhea, in order to maintain the fluid loss from the body, providers administer saline. So what happens is the first thing should be an infusion, which is of a chemotherapy substance, followed by the injection. Later on, perhaps the patient has an ailment as excessive nausea or of pain or for any other management of a malady. Here it becomes a therapeutic drug substance. Here again the diagnostic infusion takes place as a first, followed by the IV push, IV injections, hydration services. So chemotherapeutic infusion stands on top, followed by chemotherapy injections. Later on by the therapeutic infusion, the IV push, the injection and the hydration services. So you should understand one thing, for both the professional and the facility, only one initial service needs to be reported. That means when there is a combination of infusion, push and injection, what happens is you need to report one primary code and then followed by the add-on codes for all the other ancillary procedures. You will have to figure out which one would be the first code based on the reason for encounter for the physician or for the hierarchy for the facility. So normally such type of services are rendered in a hospital setup. So mostly for exam purpose, you would be given a facility reporting. So please understand the hierarchy and then you can easily figure it out. While coming to this hydration, we are supposed to report only after 31 minutes. For example, if the physician is giving the hydration, say for example salina dextrose for like 20 minutes, then this cannot be reported because a minimum time period of 31 minutes needs to be reported. In case a provider is giving for like 2 hours as a patient is having like dysentery, then we can go ahead with 96360 and 96361. Here it was only the hydration service that was done, so we can report the primary code for hydration itself. In case a push is been given, then report the primary code for push and then the hydration.